Yeah, I will open the 3 minutes, Salem, so you can read. Yeah,
Yeah, thank you.
yeah.
Can you scroll down?
Yeah, sure.
Scroll down. Thank you.
Yeah, well, would you like me to scroll up or
Yeah, on the the previous consultation.
this one?
Yeah, thank you. Yeah, can you scroll up
Yeah,
on the
sure.
first page?
Yep,
That's right. Okay. Okay.
good.
Thank you.
Okay, okay, go ahead.
Yeah. Hello, I'm Dr. Sanam, one of the GP from the practice. Am I speaking to Mr. Amir Khalik?
Oh, yeah, I'm Amir.
Yeah. Hello, Amir. Before proceeding, can I confirm your age?
I'm 42.
Thank you. I understand that my colleague has reviewed you because you were having urine infection and he arranged some scan. So we are here to discuss about the scan. Is it right?
Oh yeah, doctor, but I didn't have infection at that time. Yeah, I know that I'm getting recurrent infection, which is
Mm-hmm.
annoying, but at that time I had some, pains, and he said
Mm-hmm.
it might be constipation. To be honest, I'm still
Okay.
constipated. I'm
Mm-hmm. Mm-hmm.
struggling from that, but he said
Mm-hmm.
I will do scan just to check. So I'm
Mm-hmm.
not sure. He was not that
Mm-hmm.
helpful, to be honest, doctor. I'm so sorry
Oh,
to
I'm
say that.
sorry. Yeah, I'm sorry to hear that. I will try my best to help you today, but at any time I'm not helpful to you. If any thought or anything, you can interrupt me. Do you have any thought what could be the scan result? Sometimes people do check on NHS app.
No, not really. I'm not sure. I didn't have a chance to have a look.
Okay, okay. Any particular worries or thoughts?
Just my main worry is that the pain is is worsening now, and I want to know what's going on, and I'm keep taking ibuprofen, and it helps sometimes, but
Mm-hmm.
until when I will keep taking painkillers?
Mm-hmm. I understand that it's difficult for you. I will try my best to help you today. What were you hoping to achieve today?
Um, just to know what to have a diagnosis, to be honest, doctor, and then
Okay.
prevent the pain from coming back.
I'm just writing down in my notes so that I don't miss any point that what you were hoping today. So I have scan result and the scan showing, can you scroll down? The pain you're having on your right side could be related with the kidney stone.
Oh, really?
And yes, the scan has confirmed that there is a small tube which connect the kidney and our bladder. Bladder is where the urine collect. That tube is inflamed.
Okay.
Yeah, and are you with me?
Oh, yeah.
Yeah, and it can be a urine stone. Yeah,
Mm-hmm.
yeah. So it
Okay.
can be urine stone. Yeah. So what I'm going to do, I will ask some questions and I would see what could be the possible reason.
Sure.
Yeah. So you told me you're having pain which is getting worse. Is it the same pain which you're having and since how long you're having it?
Well, I think now we are about nearly 2 weeks or 3 weeks, but it's becoming worse, I guess.
Mm-hmm. And is it always on right side?
Oh, yeah, it's always in the right side.
Does it comes and goes? It's there and there.
Oh, no, it comes in waves, yeah, doctor.
Okay. And if you score from 0 is the least, 10 is the highest, how you gonna score your pain?
Uh, Maybe 12, doctor.
Well, I'm really sorry. And you mentioned that you're taking ibuprofen. How much ibuprofen you're taking in a day?
Well, sometimes two, sometimes three.
Mm-hmm. Um, okay. And does the space pain goes down to your front of your tummy?
Oh, yeah, it's going to my balls, if you're asking. Yeah, it's going down to, my scrotum
Mhm,
and ball area.
mhm,
Yeah, it's going there.
mhm. Okay. Any problem with the wee? Like sometimes people do have burning or tingling sensation. Is it happening with you?
Well, not this time, doctor, but I'm always having some infection every now and then.
Hmm. Can you tell me more about it? Like when you say infection now and there, how many times did you had in
Yeah,
last 1 year?
maybe the last one twice or three times.
Okay. And did you require antibiotic? And when was the last time you
Oh,
had it?
yeah, yeah, yeah. The last antibiotic was 3 months ago.
Hmm. Okay, okay. And sometimes people do feel they notice any blood in it. Did you notice any blood?
In my way,
Yes.
no, no, I didn't notice any blood at all.
Okay. And are you passing good amount of urine or you notice it's less than before?
No, my urine, I guess, sometimes it's darker,
Hmm.
but when I drink water, it's coming okay.
Okay, okay. I would ask some questions. Is it something not serious? Yeah. Any change in your weight?
No, not really.
Any change in your appetite?
No,
Okay. And any night sweats at all?
no.
Okay, okay. And I can check in past you had high blood pressure, you are taking Ramipril. Is it correct so far?
Oh, yeah, doctor, I'm always taking the Ramipril.
Yeah. And do you have any allergies?
No, not really.
Okay. Anyone in the family got kidney stone?
Well, not the family, but I guess, doctor, I had my left kidney removed a few years
Mm-hmm.
ago, and
Mm-hmm.
they told me that because I had a stone, and I think it's make some problem in the kidney, and then the kidney become fibrosed or something. They said it's not functioning, then they need to remove it. So I'm
Mm-hmm.
not
Mm-hmm.
sure is this the case now or what, doctor?
Okay, okay. I would be getting back to this answer later on. Is it all right?
Yeah.
Yeah, I would ask some question related with your social lifestyle. Do you smoke?
Oh no, doctor, I don't smoke.
That's good. Do you drink alcohol?
No.
What job do you do for your living?
Uh, well, doctor, I'm business administrator.
Okay. And who do you live with?
With my wife.
Okay. And how much this pain has affected on your day-to-day activity and your job?
Well, doctor, I'm not able to concentrate. Okay, I'm always, I don't feel comfortable. I'm always feeling there is a problem, on my side. So really, it did affect me a lot.
Mm-hmm. And how's your diet?
Yeah, diet, I guess is fine. Sometimes I feel nauseated.
Mm,
Mm,
okay. And do you take supplements? Like sometimes people do take a lot of calcium supplement.
No, not really.
Okay, okay. Thank you so much for answering the question. Going back to your scan and your worry, what could be the possible reason? Just want to correct myself. I mentioned kidney stone at the start in the scan result. Actually, in the scan, it's showing the right kidney is bigger in size than the left one, and the radiologist, the one who do read the scans and do the ultrasound, they mentioned that it can be a kidney stone. As I mentioned, the tube that connect kidney and the bladder, we say ureter. There is a possibility that there is a stone which is blocking
Mhm,
your right kidney, between connection between right kidney and the bladder.
mhm,
So there is a possibility of kidney stone, but there are other reasons for that. But it is highly likely that it's a kidney stone. What
mhm,
is something like, as you mentioned that your left kidney is being removed because of previous kidney stone, and you have only right kidney, which is the precious one. So what I'm going to do, I will arrange and scan, we say CT scan, to
mhm,
check. Sometimes the ultrasound doesn't pick up the stone. We do the specialized scan, we say CT scan, to know
mhm,
what kind of stone is it, and
mhm,
is it stone or not. I will refer an urgent referral to the urologist who do deal or help with the people with the kidney stone. I will arrange urgent blood test to check for, as you said, you're passing dark urine and passing 2 to 3 times, if I'm correct, 2 to 3 times a day. So we
mhm,
will I will request the kidneys, I will request the blood test to check for your full blood count. Uh, I will check for kidney function test, and I will do the urine test.
mhm,
And you said like pain is getting worse and you're using ibuprofen. It's something I would suggest, if you don't take ibuprofen, because one, the kidney stone can affect the kidneys, another ibuprofen can damage the kidney more. So what I would suggest, if you take paracetamol, and I know paracetamol is not strong tablet, but I can give you the other tablet. You said like um, codeine. I know the codeine do
But
have
I'm
side effect.
constipated, doctor.
Yes, that's a good question. I was coming to that, because codeine, just going back to my word, like what I'm going to do, I will prescribe Bascopan, yeah, and and for codeine is something, if the pain is not improving with paracetamol and Bascopan, codeine is something, it do have side effect of constipation, but it do control the pain. I can give you the medicine that soften the stool and help with the constipation.
Hmm. Sure.
Yeah. Do you have any other question?
No, no, that's fine, doctor. So when I should expect all that to happen?
Um, if I mentioned urgently, it mean that what I'm going to do, I will make a call to urologist and speak to them that this is a situation now. You're
Mhm,
passing less urine. You had already one kidney removed. Another kidney is bigger in size than normal it should be, and highly likely of kidney stone. I will get back to you after I discuss with them, but more likely you will hear back from them in couple of week time. In meantime, if you know you notice you're passing no urine at all, you're noticing any fever, and I will send the urine test to check for urine infection as well. Or if you noticing the pain is unbearable, you can contact us back. I will provide you leaflet what this condition hydronephrosis, it means dilated kidney, and what are the possible reasons, and when yeah,
Mhm. Sure,
are you with me? And I will arrange a
mhm,
follow-up appointment after discussion with the urologist.
sure,
Yeah, and I will book an appointment to see you. If possible, you can come today to examine you face to face and to feel your tummy.
sure, sure.
Okay.
Okay, what do you think?
Really sorry. I thought ureteric calculus, and then I saw like it's a hydronephrosis. It's not actually the calculus. Then I
Hmm.
corrected myself.
Yeah, okay. Well, a good thinking. Yeah, it's most common cause of, but most common cause in young age or middle age, uh, renal colics is the
Mm-hmm.
stone, but that doesn't mean that it should be always a stone. I had
Mm-hmm.
patient have, uh, retroperitoneal fibrosis from sarcoma, okay, causing that. On elderly, you can have ureteric epithelial tumor can cause that as well. Okay, but these, in case of intrauterine epithelial tumor, they will present at least with this little bit of hematuria, as well as a stone can present with hematuria. But 90% of the ureteric stone can present with hematuria. But if there is a growth in the urethra, there will be massive hematuria usually.
Mm-hmm.
Um, there is a learning need in this case. Okay, I was
Mm-hmm.
not expecting that it will be difficult, to be honest. Probably maybe because we are not aware about acute and unarranged or unplanned care. Okay, that's an unplanned care. Okay, that's considered an acute emergency. That's a precious kidney, as you said. There is no referral. You will call the urology and tell him I'm sending you the patient now, or you will send the patient directly to the emergency department. This is a precious
Mm-hmm.
kidney, unilateral kidney
Mm-hmm.
with kidney stone or obstruction. This means that
Mm-hmm.
patient can lose his other kidney. There is no way to wait until you do CT scan or do whatever you will do. Okay, that patient
Mm-hmm.
need to go urgently to the hospital, either through urology on call. I have this patient, I'm sending that patient to you, or you send directly to the emergency department, which usually more sound. Okay, because the
Mm-hmm.
emergency department, he will do the kidney function, he will do the CT scan, confirm the diagnosis, and we'll see
Mm-hmm.
how the things is, and then he might consider referring him if there is a stone or obstruction. We'll send
Mm-hmm.
to the urology on the same day. Okay, because sometimes, okay, that can be pseudo hydronephrosis. If unilateral kidney and the patient is drinking a lot of water, this ureter will be dilated, okay, a little bit. So it's called pseudo hydronephrosis, but the patient is already symptomatic and has pain, so you need to
Mm-hmm.
consider that this is an obstruction till prove otherwise. The other
Mm-hmm.
learning point here is the mistake that your colleague did. He did an ultrasound scan for a patient with renal colic. So renal colic equal, and for sure in male, okay, not childbearing female, okay, not child, okay, you need to do CT scan directly. Ultrasound will not be that beneficial, okay. But very rarely the ultrasound will show the stones. Might be shown, might be, but it's very rare. Okay, and the CT scan is more sensitive in such cases. Okay, either to diagnose the stone itself or the other pathologies. So if there is retroperitoneal, fibrosis, or there is intraurethral obstruction, and they give a contrast or something, that will show if this is a
Mm-hmm.
cancer or not. Okay, the other
Mm-hmm.
thing that we need to learning need in this case is don't give antispasmodic for ureteric stones. Yeah, don't give
Mm-hmm.
antispasmodic because the cause of the spasm in this case is the increase of the prostaglandin. So you need to give an anti-inflammatory. Okay, in solitary kidney and patient that you don't have kidney function of for him, I will refrain from giving anti-inflammatory. Okay, except if I will send him to the hospital now. If he is an acute renal colic and I am have
Mhm.
access to renal function, yeah, I would start him in some anti-inflammatory, because I'm already sending him to the hospital. They will do the kidney function. They'll see if the kidney function is bad or not. But if I don't have access and I'm just suspecting that the patient having a renal colic and he's not actively now in pain, or even if he's in pain, I will try to find him some other thing, any other medication that will not affect his kidney function. Okay, because I need to make sure that this patient kidney function is normal before just bombarding him with the non-steroidal, except if I have access to hospital. So if I'm in out of hours, okay, I will do that. I will give him non-steroidal. Or if I am in the GP and I find the kidney function is normal, so I will give non-steroidal, but I will give it with caution. I will tell him, please be aware. Okay, and if the patient doesn't have solitary kidney, that's an emergency. I will send him to the hospital. So be cautious about non-steroidal in renal colic. Okay, yeah, it's the first drug of a choice in the hospital or in acute setting, but don't consider it the first drug of a choice in patient in the GP, especially if you don't have kidney function. If you have kidney function, give him have kidney function, the kidney function is normally, I give non-steroidal, no problem. But if you don't have kidney function, don't hit already a tired horse. Okay, so be cautious about that.
I said to
Uh,
him that I'm gonna speak to urology.
yeah, but that's
Uh,
at the end when I and then the radiology will see you after 2 weeks,
and
isn't
I will
it?
speak to urology.
No, you
I
are
said like I will.
mistaken.
Yeah, I was not
You
sure
are
what's the pathway with
mistaken.
single kidney and
Single
um.
kidney. Uric
Mhm.
or with query obstructive uropathy, this patient need to go to the hospital. Need go to the
Okay,
emergency department. Okay.
thank you.
What are the other thing we said? The CT scan. What are the other learning need here? Yeah, if that patient in a renal colic patient in general, okay, you are suspecting, yeah, the patient have a renal colic, okay, you did the kidney function. Don't forget to do also calcium. Don't do also doing, um, electrolytes, okay, sodium, potassium, and calcium. Why? Because as we said, primary hypercalcemia can be okay. Primary hyperparathyroidism can present with renal colic. So if you find any electrolyte abnormality, namely hypercalcemia, then you need to investigate the hypercalcemia, because it's not uncommon that hypercalcemia will present only with renal colic. Okay. The other learning point here, that patient you told him about, yeah, ramipril and the high blood pressure. Again, he is solitary kidney. Tell him, please stop the ramipril now. Okay, don't. Did you take the ramipril for today? No, doctor, I didn't take. So please don't take it. When you go to the emergency department, they will give you another antihypertensive tablet, namely calcium channel. Okay, that's very safe in such cases. Okay, like amlodipine. So that's some of the learning point in this case. Okay, in general, if the patient present for you, okay, especially elderly, please that keep it in your mind. Okay, because I saw it a lot. If patient elderly presenting with renal colic, okay, please at least in the GP land try to listen to his tummy and see if there is murmurs or not, because it's not uncommon that the patient might have triple A and he's presenting with acute tummy pain and or renal colic, mimicking, okay, the renal colic, and actually he have triple A. So consider listening to the patient's tummy. Okay, the other learning point also that I want to emphasize is patient can have yeah, patient can have, for sure, patient with renal colic would have constipation, okay, and will have nausea as well. Okay, don't forget that the renal colic, they equalize the renal pain with the delivery. So can you imagine the lady that is delivering is equal to the pain that the man will experience if he have a renal colic. Okay, And that will make vasovagal response high. Patient might lose his consciousness. The patient might come with constipation or for sure come with nausea because that's vagal stimulation. The other thing that I want to tell you is it's not uncommon. Again, I'm going to emphasize that because I met these cases when I was in the emergency department. Okay, it's not uncommon patient with recurrent urinary tract infection, patient with recurrent renal colic will be mistakenly treated as a renal colic or blindly because we didn't have any document for the stones or document for the obstruction or even document for the infection. Okay, um, was be treated mistakenly, and actually he have a triple A. Okay, it, more than 3 or 4 cases when I was working in the emergency well, in the emergency department in the UK. Okay, which is 3 or 4 years lifespan in the UK as an emergency physician. Okay, that's a lot. That's massive number of cases. Okay, if every year I'm seeing one mistake like that, that's especially it's life-threatening condition, and the patient will come to the emergency department, and with simple, bedside ultrasound, I will put just the probe in his, to abdominal aorta, and I will find it enlarged. Okay, that's mean that there is a learning need to be addressed. Yeah, it's unfortunately it's not yet the GP land is not yet prepared for having bedside ultrasound, although there is talks and then there is promises, especially from the RCGP, and there is a panel for bedside ultrasound in the GP land. So there it is in the process, and hopefully we'll find it one day, or we achieve it one day. But again, at least if you are in doubt, please don't confirm your diagnosis with a scan. Okay, don't diagnose the patient blindly. Okay, and also in such cases, please, if you feel that it's applicable to examine the testicles of the patient, that's important because sometimes the patient would have a torsion or epididymitis and will appear as renal colic, and actually the problem is in the testicles. Okay, so that's all what I want to say in this case. Okay, I will close the recording now and I will give you your specific feedback.